Swapnil is here. Good evening, sir.
Hi, good evening.
So we'll start with the next session. For the next session, designated appraiser, the art of critically analyzing a scientific paper, we have Dr. Swapnil Keny. He did his MBBS from TN Medical College in 1992 and then completed his MS Ortho from GSMC and KEM Hospital in 2002. He is currently working as a pediatric orthopedic surgeon in Sir H.N. Reliance Hospital, Polo Hospital, and is also an honorary associate professor at Sir J.J. Hospital and Grand Medical College, Mumbai. He is Executive Council member of Psychot India and also International Fellowship Committee member of Psychot International, Belgium. He has done much research in the field of medicine and surgery and has 122 citations to his name. Some of his recent works include emergency and urgent orthopedic surgeries in non-COVID patients during COVID-19 pandemic, perspective from India, and COVID-19 current knowledge and best practices for orthopedic surgeon. We welcome you, sir, and sir, please proceed with the presentation.
Yeah, thank you very much. I hope I'm heard.
Yes, sir. We can hear you.
Yes, sir.
All right. So I'm just going to try a hack. Let me see if it works. You'll have to give me 1 minute for that.
Yeah.
Okay. Can you see that?
Yes, sir.
We can, sir.
Yes, sir.
Now, just a moment. Can you see this as well?
Yes, sir.
Yes, we can.
Now, can you see my audio and video? Both?
Yes, sir.
You can, right?
Yes, sir.
So what I'm trying to do is I'm trying to share my Zoom screen so that I also know where I am, right? So a very good evening to all the viewers here. I guess most of you are medical students aspiring to be the best doctors in the world. And since that is your plan, obviously you need to know a lot about research. Frankly speaking, I really find myself not the right person speaking to you today because I am not any sort of a avid basic researcher. Having said that, research per se is not really anything which sounds or seems complex. In fact, it is basically finding a very simple solution to a complex problem. Now, the basis of a research is to try and understand what sort of a research you are reading, because unless you start reading a research, you cannot start writing one or you cannot start preparing for one. So this research essentially begins with appraising a paper. And what do I mean by appraising a paper? By appraising a paper or by appraising a research, I really need to know the value of a particular paper or the value of a particular research. Now, to appraise, for example, if I were to look at these two watches and both of them are the Rolex Sea Dwellers, I would want to understand what is the value of each of them. And I'm going to apply a specific group of tests, a specific group of criteria by which I would know which of them is the genuine one and which of them is the fake one. And the way I do it is by application of certain knowledge which I have or which I have gained over a period of time that tells me that the one on the left side of my screen is the real one and the one on the right side of my screen is the fake one. Similarly, when you're looking at research, there are two important aspects which you need to understand. One is whether it is an original research or whether it is a fake research. And the second is you also need to understand if this is an original research, then whether this is of the quality which you're looking at. Because you need to remember that the highest level of evidence is what stands. And hence, if the research quality is really low, then you will not be able to really understand where we are. So let's start with a very simple basic example, and this is the example which I'm going to share with you guys. So now let's imagine that we are looking at a new drug which is L403. Let's say that this is the new drug, and we as researchers wish to find literature which tells us whether this drug is equal or better than paracetamol or acetaminophen for headache. So you wish to find and appraise an article which gives evidence that a new drug, which is L403, is equivalent to paracetamol for the treatment of headache. Now, obviously, when you are looking at such research, you will have to look at various databases. And I'm sure somebody must have covered these databases, but I'm just going to go through them once again. So there are various scientific and non-scientific resources which are available on the internet. What we use very regularly is the PubMed, but there are many other resources which you can use to find articles. Now, once you do that, the next thing is basically to try and find that particular specific paper. And how do you find that particular specific paper? You basically find it by using certain keywords which help you to find that specific research paper, right? So now the keywords here for me is going to be L403, which is the new drug, acetaminophen or paracetamol, and headache. What you need to remember is that more the keywords, the more specific is your search, but at the same time, if you have more keywords, then you're going to get a lesser number of articles. So this is something which you need to understand when you are doing this sort of a search on keywords. The next important thing is basically how do you proceed? So once you actually have found that you have 6 articles which you have found, then how are you going to proceed, right? So the way to proceed here is basically to look at the title of an article. And the title will tell you a lot of things. It will tell you if this article is specific to your needs, whether it really supports the evidence you're looking for. Is it something very succinct and very crisp which you can use? And also whether it is symbiotic with the facts that you're looking for. So 4 different things you need to look for: whether this article is specific, whether it is supportive, whether it is succinct, and whether it is symbiotic. Now, after having done everything, you end up getting a manuscript. Now, once you get a manuscript, how do you proceed? What do you look for? So the first thing which you look for is basically the abstract. And the abstract in essence is the gist of the article. So the gist of the article or the abstract gives you a lot of information. So just these small few paragraphs, maybe 1, 2, or 3, they will tell you about the patients, they will tell you about the procedures, they will tell you about the parameters, they'll tell you about the protocols, they'll tell you about the product and the probability. So 6 P's which you can get from an abstract: whether the patients you're looking for is the right patient, whether it is the correct procedure, the parameters which you're looking for if they have been studied, if the protocols are scientific, if the product of the research is something you're looking for, and whether the results are the same probability which you thought that is important to your research question. So when you look at an article like this and your research question is in sync with the information you need, that is, you wish to confirm that there is evidence that a new drug, this is L403, is equivalent to paracetamol for the treatment of headache, the next thing you need to look for is certain things into the structure of the study, and that is something called as PICO. And PICO is something to do with the patients or the population, the intervention which was done in the study, the comparisons of the various patient populations and the outcome. So this is something which you realize once you read the paper for the first time. So you realize that what sort of patients you're looking for, what interventions were done, what were the comparative groups, and what was the final outcome of that study. Now, to understand the quality of the study, you really need to understand what is the level of, of research which you are looking at. So there are various levels of research which somebody I'm sure must have spoken about. So there is a double-blind randomized controlled trial. So when you're basically looking for the quality of the study, you basically have various levels of evidence. So the first and the highest level of evidence is the systemic reviews or the meta-analysis of double-blinded randomized controlled trials. And in case you are looking at that particular research, then you would probably realize that a randomized controlled trial for this sort of a research would probably have the L403 and the PCM given randomly. And then probably there would be the patients would be kind of, and the researchers would be double blinded. And this would be a systemic meta-analysis. Now, if this were to be a case control study, then L403 and paracetamol would be given to the study and the control group. If this is a prospective cohort, then L403 is given prospectively and compared with another study where paracetamol was given. If it is a retrospective cohort, then the effects of L403 administered to patients are analyzed retrospectively and compared with another study where paracetamol was given. And finally, if it is a cross-sectional study, then L403 is given to a cross-section of population and is compared to another study. So this is basically the quality of research. Now, there are something which you need to look at when you are actually doing appraisal. So you need to see the study participants. You need to see if there is any sort of an attrition from the study. You measure all the variables. You look at what outcomes have been studied. You look at any sort of a confounding factor or a factor which has not been considered by the authors, but which is really affecting the quality of the study. And you also look at the statistical analysis, whether a correct statistical analysis has been carried out or not. And the most important thing to look for when you appraise a study is to understand whether the researcher has been subject to any sort of a bias. And there are multiple biases. And what is a bias? A bias is an inherent kind of a protocol which you tend to follow, which may not be scientific, but which may affect the scientific validity of your study. So these protocols can be a selection bias, there can be a performance bias, there can be a detection bias, there can be an attritional bias, and there can be a reporting bias. So you may not have selected, the researcher may not have selected the right group of patients. The performance, the management, and the measurement of the exposures may not have been right. The instruments to detect these measurements may not have been correct. Patients may have been lost for follow-up, and the reporting may not have been correct or may not have been accurate. And these biases are further divided or subdivided into various different kinds of subdivisional biases, and all these are extremely important when you try to look at a particular study. The next thing which you need to look at is basically what sort of statistics or what sort of statistical tests have been applied. Now, I am made to understand that you've undergone a lecture on statistics. So, in essence, you need to really see if the test which has been applied to that particular data by those scientists, whether it is the correct test. So, if you are comparing two variables, whether the chi-square test or the correlation and regression test have been applied. And if you are comparing means, then whether the sample test, that is the sample t test, the z test, they have been applied. So this is extremely correct. What happens many a times is that you do have data, but the right statistical analysis and the tests have not been applied, and hence the entire data and the entire study really does not make any sense or any meaning. So many of these studies are published, but you really need to look if the statistical analysis has been correctly applied. The next thing which you need to look at is the charts and the graphs, whether these charts and graphs give you any added clarity or whether they add clutter. Now, many a times, charts and graphs are added by researchers to just improve the merit of a paper, not necessary that they give a lot of information. Because what is believed is that the more number of charts you have, the paper looks more authentic, but which is not really true. So you need to understand whether the charts, the graphs, and the diagrams which are there in that particular paper, whether they have given you any sort of an additional information or they have reinforced the information which you already have about the paper which you are analyzing. The next thing you need to look at is the results of the paper. Now, whether these results are something which you expected, whether they are something which are acceptable to you after having read the entire literature, whether you can apply these results to other protocols or other papers in the future, and or there are certain exceptional or controversial results which have come out of this paper. Now, these four things are extremely important to analyze when you read papers like this. The next part of any scientific paper is the discussion. And many a times you end up not reading the discussion. The reason being is that you feel that there is hardly anything you can gain from it. Having said that, discussion sometimes can probably be the most colorful part of any research because it gives you a lot of information not only about the paper, but also about the thought process of the author. It gives you certain snippets of literature which may not be in the body of the paper, and these snippets really help you correlate and understand the mindset with which the researchers have conducted this research. So you can look for reviewed literature in the discussion, the points which have been raised and compared by the authors, and finally the conclusions which they have reached and whether these conclusions are in sync with the conclusions which are there in other studies, the accepted literature, and even the gold standard. Now, the next part which you need to look into is the conclusion of the study. And the conclusion of the study is a combination of the final product of what the literature, what the researchers have got, the result and the impact they have understood that this research has given to them, and also their reflections after having gone through the entire process. So that is where you need to understand that these conclusions which have been reached may not necessarily be the conclusions you may reach after reading this paper. So there is something called as their conclusion, which is the conclusion of the researcher. You might have come to some other conclusion, and actually there may be a third conclusion which may be the logical conclusion, or which may be the conclusion which has been proven by other research. So a conclusion of a paper really needs to be analyzed and really needs to be appraised in a manner by which you understand what sort of a conclusion they came to, whether that conclusion is in sync with the conclusion you feel, and whether it is logical. The next part about appraising a paper is looking at the references. Now, references is something which everybody and anybody will not read because they are in small print, and many a times you feel that it is not important, but believe me, that is really where the treasure trove lies. And the reason for that is that it gives you a treasure of ready-made articles which you can read. Right now in today's day and age with the internet on, many of these articles you can get either an abstract or you can get a full paper on that. The authors can process the thought process, the researcher can understand the thought process of the author and can also help them understand if there have been any biases of referencing. For example, if there is a landmark article which has been published on that particular subject, but for some reason this particular article has not been included in the references or the bibliography, then I'm pretty certain that this is probably a bias because the researchers do not want to include this article, and most likely the reason for that is probably because this article has certain evidence or some information which may be going against the theme of this particular paper. So again, summarizing what I spoke, or rather getting back, I believe that each one of you can be a designated appraiser, provided you are looking at the following points. So the first thing you need to understand and re-understand rather is what really is critical appraisal. So critical appraisal is a process by which you can understand the validity of a particular research. You can understand if it is trustworthy as regards the results. And the third and most important thing is if it adds value and relevance to the research which is going on, or the research which is already present. Now, to understand the validity of a research, you need to understand the research design, the research method, and the procedures which have been followed. Now, to understand the validity, you need to see if clear statements have been met, if the appropriate methods have been followed, and if the relevant participants have been a part of this research. Trustworthiness can be found out by looking at the results which have been published, the precisions with which these results have been reached, and if this data has been analyzed appropriately. Now, the trustworthiness of results is important to understand if there is a clear statement of findings, whether the results are precise depending upon the research and methods, and was the data analysis rigorous as per the protocols. These are extremely important to understand the trustworthiness. Now, trustworthiness of results, there are two particular reasons why it is very, very important. The first reason is that the research methods and the existing evidence both have to be in sync with each other. And if they are not in sync, then probably the paper will become worthless. The value and relevance is important because you need to understand the outcomes of this research and whether this research can be applied in your routine practice. Now, whether this relevance is actually applicable is something which you need to concern, which you need to understand, and whether these outcomes were so important that they were a part of the research and can they be applied to local situations. Why is appraising important? Appraising is important because it really gives you an additional skill set which you have in your armament area, because this will help you understand the knowledge of study design. It will help you identify biases and give you idea about the reliability, and it will also help you understand judging practical relevance of research findings. So the systemic review process or appraising an article essentially is about defining the question. It is about searching and reviewing the literature. It is about selecting relevant studies. It is about assessing the quality of these studies. It is about assessing the outcomes of these studies by doing an analysis of various multiple literatures available. And finally, it is about interpreting these studies. So personally, I believe that there is a loop which drives us around. We initially start any sort of a scientific activity, specifically appraising a particular article by being observant. We then tend to reflect on our observation, and based upon these observations and these reflections, we tend to make a decision. And these are the decisions which will help us strengthen our resolve and also make us much more ardent and much more rigorous researchers. That was something about appraising an article, and this is essentially the end of my talk. But if you have about 5 minutes, I would also go ahead and tell you something about the KenSat Met Clerkship Research Program, which we run in Houston, Texas. If the other coordinators would allow me to do so. May I continue?
Yes, sir, we have time. Yes, sir, we have time.
Sure. So this is nothing to do with the study, the talk per se, but I'm just going to be speaking about this. So this is basically a research facility in Houston, Texas. The The other founder is Dr. Satija, who's my friend and colleague from Mumbai, who eventually went on and has a big pain practice there. Uh, so we started this research facility here, which is essentially for medical graduates who can visit the US for about 4 to 8 weeks and do research with us. This is the research office and the clinic as well. This is a part of the lab which we conduct basic clinical research. These are the other rooms, and let me just play you one video from, yeah. So let me see. Yeah. So this is a testimonial.
We cannot hear. I think you have to change your setting on Zoom.
So that's fine. That's fine. I'm just going to end it here. So that's fine. That was basically a testimonial about one of the students coming in from Mexico. So now I'm going to end my Zoom meeting and come back to yours, and I'm going to stop sharing. So that's about it. That's about my talk. So I'd be very happy to take questions. But before I take the questions, I just need 2 minutes to thank all of you who have done a wonderful job at this. So this is something which I should have done at the beginning, but unfortunately I was just trying to dabble with some technology, because of which I'm doing it right now. So before we actually take on the questions, I would like to thank Kalpana, the IMA, and most importantly, the organizing committee, which is Dr. Shiv, Dr. Garima, Shreya, Dr. Anirudh, Kushi, Ayush, Pranav, Yash, Prabhat, Nimisha, is it? Pravesha, and Dhairya. I would like to thank all of them. And I would also like to congratulate all you guys for doing such a wonderful job and having almost 200 people here at this point in time. So great job, guys. I'll now open to questions.
Thank you, sir,
Thank you so
Dr.
much.
Kenny, for being with us and taking up this very important area, which is often just left to the mercy of people to interpret. I believe that critical appraisal is one tool that every researcher needs to understand not just the fake from the real, but also within the myriad of these researches which are available to interpret. It is also important what exactly needs to be taken from these researches in the context of the study which the researcher intends to take in his own domain. So I think you really helped us understand with a better clarity on how to appraise and how to understand the findings of a research article, and how to make its use for a more relevant setting a more relevant context for the present research. With that, I will request the moderators to kindly moderate the question and answer sessions. Yeah, over to you. Over to you guys.
Thank you, sir. Thank you so much, Swapnil, sir. I think your session was very enlightening. So much enlightening that everyone has been thanking you and there has been no questions yet.
Oh, wow.
I think they understood very much.
So either they understood everything or they haven't understood anything. Whichever way it is.
So they definitely understood everything. You were very good. Thank you so
Really?
much, sir.
That's good. That's good. Thank you so much. Right. So should
So,
I end this session then?
no, sir, we'll have Ajoy sir here with us. So, good evening, Ajoy sir. So, at the end, I would like to hand over to Dr. Ajoy Shah, co-chairman of IMA MSN, for officially ending the webinar.
Am I audible?
Yes, sir.
Am I audible? Yeah. And of course, I just joined in at the last moment because I was told to join in at the last moment. And that was Swapnil. I think that was the real fiery stuff what he got across to all of you. I think you have had wonderful. I think the brainchild of this whole thing is, I'm quite sure, Rishil Joshi, Shreya, and Garima. I must congratulate three of you. And of course, your team. Your team has already been congratulated. The whole list has been read out by Dr. Swapnil. And I do not want to repeat again. But I really congratulate all of you. It's a fantastic thing you have done. At this level, at the, I would say, medical student level and the PG level. You have not become PG altogether, that is junior doctors level. And it is a fantastic move that you have taken. I think every step, and I just went through the speakers, and you have got right from Dr. Abhay Bham, and even you have got Derek D'Souza, the director of this National Bioethics. And of course, you've got somebody very young, and I know this guy very well, Anuruddha Agarwal. And I think he's the founder of this public that has come out and has associated with this webinar. And this is what MSN and JDN is. I'm quite sure Shiv will agree that, or he'll agree with me, Shiv and Shreya, and even now Garima would also start agreeing that this is what MSN and JDN is. It gives you an opportunity much before you're supposed to get the opportunity. You see, such type of opportunities we never got even after you become a PG. It's you have finished your MD and MS and then you think in terms of research. Here you're thinking in terms of research at the undergraduate level. So you're getting groomed so well. And this is going to help you throughout your life. This is going to add to your skills, add to your thinking power, add to your creative nature. And of course, you can become a bit of an entrepreneur by starting out something new on your own. And it adds to, of course, your CV, ultimately your CV. And it just opens out your range. It's a wide way. It just widens your horizon and it gives you chance and it gives you the reach to go anywhere. They say the sky's the limit. You can think of that. You can think of anything. And they have already, I think, this 10 speakers have given you exactly right from A, B, C, Z of what methodology you have to use for doing research. So anyway, I am very happy and I am very glad that you people have taken up such a big step, such a big workshop, and definitely it has been very, very successful. I think we have got more than 200 people watching this show. And I think you should just keep going on. So this is one of the best, I would say, workshops I've ever seen. Because I do not have exposure to a lot of workshops. But anyway, and once again, I would like to congratulate Shiv, Shreya and Garima and the team that you have really done a wonderful job. This is something out of the books. I'm telling you, people of our generation can never think that you people can do this. And actually, you should be doing it. So because you belong to this generation, not the older generation. And thank you for just asking me to come in, because it was really enlightening for me also. The thing I feel a bit sad that I was not born at your age. I was maybe 1.5 decade earlier. It doesn't matter. I've had my fun, I've had my time during my time. So you have your fun and your pleasure at your time, at your era. And thank you very much. And I think I must wish good luck to all of you, and especially Pubgeek, the founder. I don't know if I can speak to Anuruddha. Is he still with us? I think he was there yesterday. And anyway, it doesn't matter. And all the best for your future endeavors. Thank you.
Thank you. Thank you, sir.
Thank you so much, sir, for always supporting us and letting us do all these amazing events and for always helping us out. And also to Shiv, sir, he helped us a lot and really as a great motivator and our patterns, we have you with us. Really, thank you so much.
Thank you. Thank you.
Shiv is an innovator. He innovates a lot of things. He is a